Hi, I'm Dr. Sarah Sears. I'm a urogynecologist at the Metro Health System. Today, I'd like to talk with you about some common urogynecological issues that I see and treat. I am a surgeon who is specially trained to care for women's pelvic floor disorders. I treat vaginal prolapse, urinary incontinence, as well as other conditions that affect the pelvic floor. Vaginal prolapse is a loss of support of the vagina and uterus to the point that a patient sees or feels a bulge on the outside of the vagina. There are several things that can cause vaginal prolapse, which include your own personal genetics and family history, a history of pregnancy and vaginal deliveries in particular, and it's more common as people get older. To evaluate prolapse, we do an exam in the office to understand the extent, and we have several ways to treat it based on what we find on exam and the patient's goals. We could do nothing if it's not bothersome to a patient, as it's typically not dangerous. We can use a pessary, which is a rubber ring, to push the prolapse back into place, or we can perform surgery. There are multiple options available for surgery, which include both vaginal and laparoscopic surgery. Urinary incontinence is involuntary loss of urine through the urethra beyond a patient's control. There are two types of urinary incontinence. One is called stress incontinence, which is leaking when you cough, laugh, or sneeze, and the other is called urge incontinence, which is leaking when you have a strong urge and can't make it to the bathroom in time. Many people think that urinary incontinence is normal as you get older, but it is not a normal part of aging and is something that can be treated. The treatments for stress incontinence include things like physical therapy and surgical options, and treatment for urge incontinence include things like physical therapy, medications, and procedural options beyond medications. At Metro Health, our dedicated urogynecology division has multiple fellowship-trained urogynecologists who see and treat complex issues related to the pelvic floor every day. We have the ability to do a full workup to diagnose and follow up with a treatment plan for you and your issues. In addition to prolapse and incontinence, I also treat fecal incontinence, pelvic and bladder pain, recurrent urinary tract infections, postpartum pelvic floor trauma, vaginal fistulas, vaginal cysts, and other pelvic floor disorders. To schedule an appointment, you can call 216-778-4444, or for more information, visit metrohealth.org/OBGYN. Thank you.